Time now for this week's Health Matters. Paul Critz with you, along with P.A. Lynn Szabo. And today we're talking autism, or more specifically, what is it actually called?
It's called Autism Spectrum Disorder.
Exactly.
Because it's not a disease. It's a syndrome. And in medicine, what that means is probably symptoms that are similar from person to person, but have widely varying causes.
Okay, right.
So the person got to that place for different reasons. Not a disease. Also, that makes it harder to understand because you're really talking about a bunch of different diseases.
Right.
And harder to treat.
And
harder
it seems a
to
lot
prevent.
of, like the bar as far as understanding is very low these days. There's not a lot of understanding going on, it seems, especially at the highest level.
Not at all. Not even any respect, too, if you think about it. But autism spectrum disorder represents a neurodevelopmental condition that's thought to actually represent neurologic problems and cognitive. And on the continuum of the human genome, it's thought that this is just one of the possible outcomes that people have from developing antepartum and then...
Developing antepartum?
No,
What's
sorry. Prepartum. I'm forgetting the word for it. And then developmentally antepartum. So it's not like one thing does it to people.
Right.
And it's very different from person to person, even though there might be overlap in symptoms. And there's even overlap in symptoms for with other kind of comorbidities and disabilities such as, or learning differences, I suppose, such as ADHD, dyslexia, and dyscalculia, which is problems with numbers. And not surprising, goes along frequently with depression and anxiety.
Sure.
Yeah. And so there's factors that are genetic and factors that are not genetic, and more, I guess you could say, environmental. But the prevalence is, and there's a lot of people, 52 million people worldwide have been diagnosed. And there's a lot of people who haven't been diagnosed. And then there's the problem with perceived increase in prevalence, which is probably just more increased perception of the disease and who might have it.
Right. We saw the same ththing with COVID. The increased
totally.
testing is coming back with more positive cases. Go figure. Yeah.
Right. So a child here, if they're coming into their well child checks and they're and the provider is concerned with their developmental progress in their talk of autism, it's on the table, then what happens is the child is referred to Redwood Regional Center, RCRC, and it can take up to a year to be evaluated. The way the evaluations, I know.
Is that just a backlog, just kind of how it works with an organization like RCRC?
Yeah. They don't have the resources they need to meet the demand.
That can be very valuable time lost, if my understanding
absolutely.
is. Yeah.
Absolutely. And, for a lot of reasons, kids don't get the referral very quickly. And so what happens is a parent is given a bunch of paperwork to fill out, kind of questionnaires, and then they turn it in, and then there's silence for a long time, and then they get an appointment, and then the child, then they wait for the appointment, then the child is evaluated. So I think instead of trying to find a singular cure, maybe we should diagnose better and treat better. So anyway, that's just my thought. It's super frustrating to moms because the kid can't get the resources. And oftentimes the child is like just about ready to be thrown out of, early Head Start or nursery school or TK or kindergarten. And so it's a crisis point for the family. And then the response is the snail.
Yeah, that's remarkable.
Yeah.
I've known people in the city folk who have had. There was one who had a child who was identified, diagnosed early, and got a lot of early intervention.
And it made a difference.
Made a big difference.
Huge difference.
Yeah.
Because at that point, you're also treating the family. Yeah. So about 1 in 44 children have it.
Is this worldwide or in the United States?
No, this is the United States. By the age of 8 years, and more so, more frequent in boys than girls for unknown reasons.
Well, I've heard things too about how just there's bias in the diagnosis because boys are more like with ADHD, they act out more as opposed to girls.
Right, the comorbidities overlap, and it can be hard to tease them out. So, especially with ADHD, it's a common diagnosis. It's usually made by tired parents and teachers kind of insisting on quote unquote medication, and it's I don't know. To me, it sounds like a huge big label and a big direction to go without any super great clarity, and it worries me, especially in Del Norte County, because it's just not as easy as handing a kid a med. It never is.
Right.
In fact, most of the treatment, when I was researching this over the week, most of the treatment is not pharmacologic.
No, it's behavioral.
It's behavioral.
Yeah.
For both the individual affected and then also the family.
Is that any sort of indicator as to it not being a disease with a magic bullet sort of cause?
Absolutely.
Okay.
It is not got the strep diagnosis, get the penicillin, all
Right.
better. It is not that simple. And, kids have, the comorbidities have to be under control too. Otherwise, the progress will not be made. So
Right.
oftentimes associated with HD or ADHD type activity, or what I see is a lot of seizure disorder, especially in really affected kids. And every time somebody has a seizure, they give up a little part of their brain.
Oh, wow.
Which is
Did you hear that too?
Yeah.
Okay, good.
Hey, Matt. Anyway, so the management of the comorbidity is super important, and ideally managed by, somebody specialized in pediatrics. Because I love to read the notes that our pediatricians at UHS write, because they're so detailed and they're so whoa, I never thought of that.
Really?
And I thought that was kind of normal, so I learned from them immensely. And
Wow.
it's not like the care has to be ongoing with a pediatrician, although that would be ideal. But the primary care team can pick up with, support every once in a while, like maybe yearly support, or if a problem comes up. So the main reason we're talking about this today is RFK Jr. is, in his leadership, in air quotes, has stopped a lot of really promising, almost to significant finding research, and then hopped on the bandwagon that there is a single solution for this problem.
Wow.
And that he promises a cure by September, and then he backed away from it.
Because that's a ridiculous claim to make.
Well, what that sounds like to me is they already have the quote unquote paper written, and
Really?
they just need to put it on the right letterhead.
Wow.
Yeah. But he's backed away from that.
So I've been aware in the news coverage in just the cannon shot, the fusillade of just absurdity coming out of Washington these days.
Right.
I've been aware of him jumping on the bandwagon and saying, "Oh, we're going to cure this." There was a wonderful meme I saw that was a quote. It quoted him standing at the podium in one of his press conferences about autism, and he's talking about, there are diseases. This is a disease there are diseases that weren't a thing when I was a kid.
Yeah.
And somehow he takes that as being some sort of folksy wisdom, common sense sort of thing, to pointing at the absurdity of all of this. And somebody had responded, "And your aunt was lobotomized for being hysterical."
Right.
So that's how these
Right.
things change or don't over time.
Right.
But I had lost, what sorts of things have been canceled by him? What sorts of research?
You mean real actual research?
Yeah. Because it's one thing to be the clown, but it's another
Right.
thing to really be dangerous and cut
They
actual
have
science.
some questions that a small number of autism could be tied to the age of the father, parent, and they also have kind of a small number of kids that their autism might have been tied to the mom taking an anti-seizure medicine called
Right.
Depakote early in her pregnancy. But again, these are multiple diseases. So, those are, they haven't come out and say that. I don't think any pregnant woman now would be put on Depakote, except if she had a seizure disorder that was really horrific.
And did they stop looking into those things? Is that what you're saying? Okay.
Apparently the brakes are on all that.
Because, that's kind of an
Because-
implicitly acknowledging that it's a genetic cause to it.
No, he believes that it's an environmental disease because it has to be,
Because
by his opinion.
it has to be?
It has to be because,
Do we have any sort of understanding as to what goes into a statement like that for him?
well, he has no data.
Right.
Right, and he rejects there's any genetic tie at all.
And actively, foiling any attempt to trace that.
I think what you're getting at, and what I kind of suspect, but I didn't see it clearly outlined in these articles that I read, are vaccines. I think he's trying. I think he has a kind of fake report that's going to come out around September, maybe a little bit later, and it's going to, it is vaccines.
Oh, my God.
But the original study that didn't really hypothesize, came out and said it only had about 8 to 12 specifically curated kids.
Wow.
Right.
That was the pool for the original study?
Yeah, with the intent to, quote unquote, prove
They were looking
this.
for, yeah.
And then, of course, the physician who wrote that paper was published initially in the Lancet, and then they disowned it. Has pretty much been disgraced, but he's still going around the country trying to be right. And he scares people. When I talk about immunizations and vaccines in the exam room, mothers are shaking.
Oh, my God.
They're afraid. And it's really weird to see what goes on in their mind when they have unimmunized children because they're afraid of autism, but they end up with an autistic kid anyway.
Right, exactly.
So,
and then an autistic
so their
kid
own
with
little
measles.
family experiment disproves their point.
Exactly. Wow.
Yeah.
Do you? I mean, this is an aside, right? But do you have any sort of feelings, thoughts about what motivates the anti-vax? I mean, because a lot of these shenanigans these days, you can point to like money and go, all right, here's a profit thing. Somebody's making money off of this ignorance that's being spread. I don't know. I can't intuit that right off the bat with the anti-vax movement.
Well,
Do you know of any sort of motivation?
Yeah, I think the thing that's even more valuable to us than money is our children. And
Sure.
And being, especially a first-time mother, is a really scary
No.
thing.
You're misunderstanding what I'm asking. It's
Okay,
not
got
about.
it.
It's not about the person who's like hearing the stuff.
Oh.
It's about the people putting it out.
Mean
like
the governmental support and stuff.
anybody who's walking around spreading this disinformation. I mean, what is their motivation? And I don't think it's because they care about our kids.
I think people want a scientific conclusion to be what they think it is, and not necessarily what the data bring us
So
to.
it's just ignorance. There's no money involved. There's no end goal. It's just people being stupid.
There's probably money involved because somebody on the side is going to tell you cod liver oil is the way to get around measles and stuff. So there's shenanigans kind of peripherally, but I think it's somebody wanting to be right to the point that they're causing incredible harm and they can't let go of it.
Okay. It sounds almost like
ego-driven. Maybe it's the worm talking to him. If we're talking about Kennedy,
a good worm and a bad worm.
Yeah.
Because I guess what I'm doing is the same sort of thing. Is I'm looking for the anti-vax movement to have some sort of magic bullet single cause, just as RFK Jr. is looking for autism to have a magic bullet single.
Well, I think that's why this paper that's supposed to come out in September is supposed to exist. I think that's supposed to be the magic bullet, the clear determinant, which
will
is
ignore science,
which has no data.
Yeah.
He said publicly that he believes that it's environmental because it has to be. What kind of logical conclusion is that?
It's not, because, I mean, peel it back at all. Environmental can very much be the same thing as genetic, because our genetics respond to the environment in so many ways. And it's just...
It's all the same ball of wax. But you can't really even compare that. How can you, what's going on in Central Texas that's also going on here? I mean... I don't know. The sun comes up in the morning. It seems to me...
He's going to tie it to food dye and things like that, maybe?
Yeah. I think he's going to have a priori conclusion.
We got like a snake oil salesman in charge of our health care. And a stupid one to boot.
Yeah.
Wow.
And I think this kind of, I have to be right because this is the way I see the world, kind of was allowed to blossom during COVID. For a lot of reasons, because it made headlines, because talk radio shows found it interesting, because then people could think they were smarter than they are.
Right.
I have a friend who's all about the Kennedy and his position because she says he's so educated. And she says that like she's fawning over like a movie star. And I'm like, no, he's not.
No.
He's like, where did he go to med school then? He's pronouncing all these medical things.
Yeah.
He did go to law school, but he also took drugs for, heroin for a long time, and he's got this weird brain worm.
And talks about being anti-vax and had his kids vaccinated.
Yeah. That's because his wife has more sense, but she is married to him, so.
Yeah.
Anyway. So he cannot back his conclusions with data, so he's kind of going to make it up, is what I think.
Wow.
So I went to the Autism Society, and they have big concerns about this.
I bet.
What his real intentions are. They called his comments hurtful. And it is hurtful because the individual with the symptoms and the disorder somehow did something wrong, I guess, or his mom, when she decided to have him immunized, did something wrong. Or you see the shame in it?
Yeah.
Especially you as a parent, you carry, how we parent is usually and should be super important to us. And even if we make a tiny mistake, like yelling at a kid, maybe when we shouldn't have, I mean, it like rips our heart out. So yeah. So every parent, I think for the most part, if they're good parents, they're really trying to do the best they can. And how this is just a big old guilt trip. But the other thing he said, which I find kind of annoying, is they won't ever pay taxes. Well, really?
Wait. People on the spectrum, people with autism will never pay
taxes.
Yeah,
and then he said a bunch of different things. They will never date, and they will never, I forget exactly. But the first thing out of his mouth is they will never pay taxes. Like, what are we, plebes or serfs or something?
Well, that's exactly what we
really
are to this regime.
Is that our sole reason to be on the planet, is to enrich the government?
Yeah, right now. Yeah.
There's a lot of people that don't pay taxes, and we call them oligarchs.
I got all my money back this year because I'm so poor. Does that count?
Oh, okay.
Am I autistic now? And that just a patent misunderstanding of what people with autism, how autism is expressed, and the spectrum aspect of it. You can have all sorts of ways to be on the spectrum.
It's true. I see a lot of, like even in clinic yesterday, I saw somebody who I thought was a real functional adult, and she disclosed that she had this diagnosis.
I don't know. Maybe he's right. Isn't Elon Musk on the spectrum?
Yeah, there you go.
He doesn't pay taxes.
That's the problem with just making stuff up. There's all kinds of ways to knock it down.
God.
So, but these people are real people, no matter what level of functioning they're at. And a lot of them are humans are valuable to the community, and we just need to figure out how to support their value. They deserve dignity, and they deserve actual valid scientific insight.
Yes. And especially from the government.
Right.
Especially from the government.
Right. So the take-home message, no single cause. This is not an epidemic. There's no single solution for it. It is not preventable, and it is not a disease. So the person leading the charge here has like flunked the basics.
Right, right.
And it's so disappointing, and it's so, I don't know. If I had an autistic person or family, I would just be enraged, I think.
Mm-hmm.
So really difficult to believe they would do this to people.
Does he have so he talks about what it says here in the notes that I got from you. He promises a cure by September. So, and that it's preventable. So is he talking about people with autism can be cured? Or is it just the prevention side of it?
He's not specific, so I don't know that I could say that.
I was expecting something perhaps incorrectly.
Well, I think the big thing is, let's say if he's going for the measles, mumps, rubella is the cause, or the vaccine is the cause, and we'll just stop immunizing children. I have yet to meet a parent of an autistic individual who believes vaccines were the problem.
Really, yeah.
So the people that live with us 24/7 are not really vibing on that, not at all. So, but there's certainly a lot of fear on it. But let me just say, as an aside, number one, measles is a preventable disease. Number two, unimmunized children. I wasn't aware of this when we talked about what measles is like. But in unimmunized children, oftentimes they lose 70% of their immune memory. And so all those diseases, let's say this hypothetical unvaccinated measles kid, 7 years old. So that means all the nights with croup, all the ear infections, all the upper respiratory viruses, all the influenza, that's part of that 70% where their immune system is like, never seen this before. We'll have to rely on the innate immune system and not the acquired immune system. To me, that, I was appalled.
Yeah.
Really appalled. So no good reason to not vaccinate, in my opinion. Yeah.
And I forget, we looked it up a few Health Matters is ago, how many hundreds of millions of lives had been saved over the course of the 20th century because of childhood vaccination. It's ridiculous.
Right.
There's one thing here that we skipped over, and I think it's very important. It's the collecting of records, the list,
God, yes.
the registry.
Oh, my God. So supposedly in this study, which sounds to me like if they're collecting information from so many different places, including people's private medical records.
So let's be clear. It's the National Institutes of Health, or whatever's left of the NIH at this point, right? Collecting private medical records to pass along to Health and Human Services, getting information from pharmacy chains, lab testing, genomics, and information from Veterans Affairs and Indian Health Services, as well as insurance claim. And even smartwatches, right? So it's getting all of that.
That's creepy.
That's very creepy. That's extremely creepy. That's Big Brother right there.
Right.
There.
It makes you wonder, doesn't HIPAA mean something?
No. HIPAA
Apparently
does not mean something.
HIPAA's been weaponized to use as a tool to fire people.
And to keep people from looking further into things, too. Yeah, HIPAA, privacy.
Completely.
Yeah.
Yeah, so they are getting a lot of data. I don't know how they're going to organize that, but I don't know what they're going to make of all that. But if I was the mom of a child that was on the spectrum, I'd be furious about that. So are they looking at immunization records? Most likely. Most likely.
My God.
And where people live and stuff like that. But
does the individual, does the parent of a child with autism or an autistic person themselves, what sort of recourse do they have? Is there anything to be done with this? Do we have state agencies looking out for us? Do we have anything?
Not that I'm aware of.
Wow.
But I also think I think in general, this particular government, the individuals carrying out this stuff are going to be individually sued.
You think?
Yeah, for a plethora of reasons.
Yeah,
But I think there's going to be precedent for holding actual individuals. responsible.
Anticipate, and this is horrible because there's so many like worst case scenario conspiracy theory kinds of things out there. But just as that judge was arrested for getting in between ICE and an immigrant, do you see a time? Do you foresee a time where doctors who are vocally pro-vaccine are persecuted, perhaps even arrested for their stances?
Yeah, absolutely. It's terrifying. It's terrifying.
It's disgusting.
Yeah, actually, there's a certain part of my panel in my practice that involves OB, and the doctors that I work with are terrified.
Really? How so?
Because they can't do medicine in a data-driven,
but how specifically
way.
so? How
specifically? For example, what if somebody has a miscarriage? How are they going to handle that? Oftentimes it just happens and, everything's okay. But there are opportunities or situations where there has to be intervention, say like a DNC, because there's retained products of conception. How is that going to be interpreted by a legal person who's not a medical person and not the family that suffered this loss?
Right.
So somebody completely Big Brother, not their business. So, yeah, they're quite concerned about it. I know.
I hate leaving it like this. Is it? I mean, if we don't have recourse, even just.
Well, I think if something comes out in September, I think that's when the sparks are going to fly. I think there are probably going to be organizations like the Autism Society that are going to react to that. And it's probably going to be added to the list of things that we protest. That we take to the streets and complain about, because there's been some success with that, actually.
I'm waiting for the irony to collapse. This kind of tension that is here's where the regime is dismantling the administrative state, and at the same time weaponizing the parts that are left. Right. At some point, it seems, the way these agencies are firing people, and they're not going to have any teeth. They won't have any ability to do anything about stuff. It seems to me like that.
And then the state government. So that's what's happening, in the post-Roe era. Is the state government picks up and then has their own version of whatever those lawmakers decide they want.
Wow.
Yeah. It's super scary. Number one, glad I live in California, but also wondering why I live in the United States.
Right, exactly. I think the same thing. Property taxes suck. There's a lot to be said about California, but there's a lot of very, very positive things to be proud of living in California.
Right, and I also feel even on the individual community level, like the people who are working at UIHS administratively, and the people who are working at Del Norte Community Health Center administratively, and probably even Sutter. I don't really know that much about the administration in Stellant, but they are formidable people. And to think that they're just quaking in fear waiting for something to happen is really underestimating them.
Yeah.
Especially in the Native community, because they have a special interest. They should probably tell their own story, but they have a special interest in getting good health care.
Yeah.
And they gave up a lot for it. And they're going to defend it. They're going to defend it. They are fierce. So, looking forward to that battle.
All right. Let's find a positive note to end on here. We got about a minute left.
I think this is actually going to open the conversation about autism, and it'll kind of bring it out into the light. And once we get beyond, the clear, not appropriateness or stuff that isn't true, we're really going to see these, I think, people that and families that are dealing with this in a different way and maybe more inclusive way.
More inclusive meaning what?
Meaning that we'll all be able to be together to solve problems, and that we'll all be able to welcome this diverse group of people into our community, because they're not without gifts.
Right.
And we could certainly use the help.
And the tax dollars.
Yeah, not so much. But
Lynn, thank you for that. Any thoughts about next week?
Yeah, well, it was recently Medical Laboratory Week, and I got a request that the head lady at UHS wants to come and talk about that career.
Ooh,
which
cool.
is exciting for
Yeah.
Bill Norton.
We'll have a guest next week?
It's totally doable.
Right on.
I'm hoping so.
All right. Well, thank you very much, Lynn.